Okay, so today we're doing the sterile dressing. I would come in, I would do my general principles and safety practices, make sure I identify my patient by name and date of birth. The bed's already at a working level. Typically it would not be, but I would raise that, put down the side rail. I would perform hand hygiene, and then apply my gloves. I would explain to the patient what we're doing, why we're doing it, answer any questions that they may have. I'm going to try to expose them as little as possible. So, going back here. So, I take my ABD pad off. I want to make sure I talk that. Same goes for my gauze. I'm going to count my sutures or staples. Today we've got staples, there are 10 of them. I'm going to look for any signs of infection or drainage. Once that's complete, I can remove my gloves. Perform hand hygiene again, and I'm going to set up my sterile field. So with everything that I open, I want to make sure that I leave a 1-inch margin. I want to open it away from me. I don't want to cross-contaminate. So it's kind of hard. These have already been opened, so we're going to make do with them. So my culture specimen here, whenever I open it, I just want to hold it in the package and pop it up just a little bit, so whenever I'm sterile, I can just pick up the tip of that. I've already got my tape out. Once that's complete, so my saline, I want to check the expiration date, I want to lip it, and then I want to saturate my gauze. I don't want to turn my back on my field, I can keep it in the peripheral line of vision. Now for the hard part. So once again, I've got a 1-inch margin all the way around. Touch the inside of the first glove. And then I want to go on the underneath of the lip, the second one. And of course it's backwards. Once I get it on, I can fix it. Now, once I have my gloves on and I'm sterile, I don't want to go below waist level. First thing I want to do is I'm going to clean the outer edges of the wound. Be sure not to actually touch the patient's skin. I'm going to go down the middle. And then I want to get my culture. Just want to touch the actual culture tube itself. ABD pad. And once my ABD pad is on there, I don't have to be sterile anymore. I'll tape it up. I would probably assess their pain level as well whenever I was in here to make sure that if they did have pain, I would assess it before I did this, and then that way if they did need something for pain, I could make sure they had that beforehand. Once it's taped, I want to sign, date it, put the time on here. And bring it back up. going to fill out everything needed on my specimen, name, date of birth. I don't have my glasses on, but all the information needed on there. Put it in my specimen bag. And then I'm going to lower the bed, raise the sidebar, make sure that the patient's comfortable, perform hand hygiene, and that should be it.